The focus of our conversations is around personality disorders, and it will be very interesting because I am a complete blank slate when it comes to personality disorders. And trust me, I was a bit, I won't say terrified, but when I don't know anything about something in terms of experience, I know nobody who has the challenge, I don't have the challenge, and basically I don't know much about it. So today I come as a blank slate, ready to learn. And I hope we all are also ready to learn today as we share ideas and as we receive information, education from our guest panelists. Our panelists to help us with today's topic are Mr. Segun Matthew, some of us who are regular members of the audience on the conversation. We are familiar with Mr. Segun Matthew. We also have Dr. Timi Oyebodi, who will be joining us. She is not on yet. And then we have Holly Joy Macab. We look forward to her joining us. She will be joining us from the United States. We hope she will be able to connect soon. So thank you, Mrs. Adeleke. Thank you, Mrs. Awoni. Thank you, Adirunke. Thank you, Mrs. Ohaka, Zipporah. Mr. John Samuel, you're welcome this morning. Thank you for joining us. Is it Miss or Mrs. Jennifer Okotie? You are welcome. We appreciate your time. And then, pardon me, Olaide Majakutumi. I don't know if you're a Mr. or a Mrs., but you are welcome this morning. And one Audu. Thank you for joining us. Mr. Segun Matthew is our panelist, and I would like him to introduce himself. There's no one who tells one story like oneself. So I won't do his introduction. I would like Mr. Segun Matthew to introduce himself to us before we move on to the next item on our agenda for this morning. Mr. Matthew, the floor is yours.
Hello, good morning, good evening, good afternoon, wherever you are. It's nice to be online at this moment to meet these beautiful faces. And some of you I know, some of you I don't. My name is Segun Matthew, and my background, I have a background in psychiatric. I studied psychiatric nursing from Coventry University, and I practiced also as a psychiatric nurse for about 9 years with the National Health Service in the UK. And afterwards, my role changed. I went to study integrated psychotherapy in Birmingham University, both in West Midland in the UK. So, and presently, I'm in Nigeria. I practice as a full-time as psychotherapist. My core pathway is cognitive behavioral therapy. I've had training in integrated therapy, cognitive behavioral therapy, addiction recovery, human behavior analysis. And at the moment me and some of my partners, we run a counseling institute in Lagos, Nigeria, called Attitude Development International. And presently, today is a unique day at our practice. Some of our students, they are graduating this morning. And so basically that's also, so my core area is promoting mental health, helping people to recover from addiction, and also helping people to modify their behavior. My online platform is called Perception Modifier, and I think that's basically about it. And it's a pleasure being here this morning. It's a privilege. I count it as a privilege to be online and to share, to learn from everyone online. And I hope today is going to be an exciting and interesting experience for everybody.
Thank you, Mr. Matthew. Thank you so much. Like I said, you see, I was correct. There's no one who can tell your story like yourself. So now, and I'm just grateful and glad that we were able to hear all that Mr. Matthew has shared about himself. So we know he is very competent in discussing today's topic with us. We have as another member of our panel to tackle today's subject matter, Dr. Timi Oyebode. You're welcome, ma'am. Please unmute yourself and tell us and introduce yourself to us.
Okay, thank you so much, everybody. It's a great honor to be here with us. I am Timi Oyebode, generally called Dr. Timi, because I have a PhD in counseling, but my areas of interest or major focus is actually trauma counseling, trauma recovery, that cuts across emotional wellness, individuality, and joy on all sides. So I do family counseling, individual counseling, marriage counseling, trauma counseling, and wellness, mental health wellness in general. I am also the head of ADI, that's Attitude Development International Counseling School here in Lagos. We run a system whereby majorly we promote professional counseling and counseling wellness across. Okay, so we equip counselors. We also promote professional counseling. What else about me? Yes, I'm a simple lady. I love life and I love to enjoy life. I don't know. I'm married. I'm trying to think what else needs to be known about me. You know, but I think those are basically things that I would want to say about myself for now. Thank you.
Thank you, Dr. Timi. Thank you. That's fantastic. You're welcome. Good morning, good afternoon, good evening to Mrs. Yemi Oludele Dare. We have with us Tony Adeyemi. You're welcome. Mrs. or Miss Seliato Ohimo, we welcome you to this platform this morning. I see Andrea Maxon. I hope I pronounced that correctly. You're welcome. And then I see Mr. Akintunde Damilare, if I'm correct. So you are all welcome this morning. Thank you for joining us. Thank you for spending your time with us. You can see we have a wealth of resources on this platform. I would like you to take note of the resources available to you through our panelists. And should you need, any kind of service, you can follow up with them. We try our best in MindSpec to bring to you the cream of the crop when it comes to the issues that we tackle, because we, like Dr. Timi says, she enjoys life. We all need to enjoy life. And that's why we're here having these conversations, hoping that these conversations will put us on a path where we can enjoy our lives, really. It's just one life that we have to live. So please feel free to put your comments and your questions, if you do have them, in our chat section. We will take them as we go along. While we wait for our third panelist, Holly Joy McCabe, to join us, I would like to just kickstart today's proceedings with a short video.
On your feet. Doctor wants to see you.
Let's go, I said.
No trouble.
Suffering from a condition known as multiple personality disorder.
Just let me die.
Without a name, you can't know who you really are.
Yes, again.
My name is But there are others here as well. Jonathan, Heather, Thomas, Harris, Joey, and Bo. For weeks now we've been talking. You've introduced me to a lot of different people, each with a different name. So my question is, who am I speaking to now?
That doesn't matter. What matters is, how do I get out of this place?
Intimidation. Next week, you're up for evaluation. If it goes well, you'll qualify for a supervised release program and eventually
I'm
parole.
so sorry, Dr.
I've done horrible things.
No,
Deny everything, confess nothing.
Why don't you hand you the damn thing?
I'll take your head off.
It's good you want to change. The only way you can get better is if
You work for the government. You're inside my head. You can read my thoughts. I'm being held here against my will.
You're here because the alternate cells inside your head have taken control.
That's hilarious. Wait, are you a real doctor? Give me a break. I know who I am.
Then tell me.
John Jacob Jingleheimer Smith. That's my name too.
Whenever we go out, the people always show.
It's just a bunch of guys. What put you in the story? Stop talking!
Never amounts to nothing. Never has before. Never will exist. That's why they're here.
D. You said D. Does your name start with a D?
That's my name too. You can't teach an old dog new tricks.
Can you hear you?
I have my own shop inside.
We need help.
What can you
All of you, quiet! I am here to help you. But I can't do that if you won't listen. The only way you're getting out of here is if we work together. Now, you were going to say something. Go ahead.
D is for Daniel. My name is Daniel.
Good to have you back, Daniel.
Thank you, Doctor. It's good to be back.
It's been a long time.
Yes, it has.
Now we can get back to work.
Hello, Daniel. I'm Dr. Blake. As you know, you'll be up for evaluation next week, and if you don't mind, I'd like to ask you a few questions. So, how are we feeling today?
I feel fine, Doctor.
Okay, Mr. Matthew, I'm going to ask you, does that video capture in any way our topic for today?
Yeah, thanks, Jen. That video capture a part of the symptoms or signs of somebody that suffers personality disorder. Firstly, I need to let you know that there are different types of personality disorder. So there is I will try as much as possible not to go very clinical in this discussion, so to make it very, very simple. And that apparently is a type of a personality disorder. It does happen to somebody that suffers some form of borderline personality disorder. We have paranoid personality disorder, we have schizoid, we have schizoportal, we have histrionic, we have narcissistic, we have dependent, we have obsessive compulsive. So there's quite a lot of them. So our focus for today will be borderline. So, but part of the symptoms is the fact that the person can take up multiple kind of personality as a part of the symptoms, or a form of personality where we present a detachment of that person from who they really are. So yes, as a part of the signs of personality disorder, that can happen. That person may experience that kind of where they feel that they show. In fact, recently I've met a young lady about 13 or 14 years that she said she has about 16 personality that she presents at different times. So it does happen. It's part of the symptoms.
Thank you, Mr. Matthew, because when I saw that video, I thought, wow, how does one cope with life with so many personalities in one? Dr. Timmy, help us to understand what personality disorders are from your experience.
Okay, thank you for that. That video, like Mr. Shego had explained, is a good one, and it gives us a clarity in vivid pictures of what could be going on with someone who has multiple personalities, more or less bipolar, or many more in one. So when we talk about personality disorder, we're talking about when one has a very rigid or an unhealthy pattern of thinking, a system whereby the person is not functioning or behaving properly. When we say properly also, that's subjected to situations and to other people, the expectations of the community or the society, the system where the person is. So once we talk personality disorder, we're talking about an unhealthy, a rigid, a dysfunctional presentation or relationship of connection that a person would have with situations or the people in a society. So in other words, what that's saying is people could be termed erratic, people could be termed odd, people could be termed, oh, it's too eccentric. People could be, you could find out different ways to narrate or to describe this person. But once we're talking about somebody whose behavior and whose relationship with people, his attitude and his responses to situations are not probably in accordance to the others, to the situation around and other people along with him, then we know there's a personality disorder ongoing there.
Thank you, Dr. Timmy. Mr. Matthew, tell us from your experience, what are we looking at so that we know what signs, what do we look at, what do we see for us to be able to identify a personality disorder in an individual or even probably in ourselves?
Okay, from my clinical experience, personality disorder is one of the most stressful, most strenuous, and most horrific illness in mental health. In fact, if I should start painting an experience to you, it'll be very horrific. It will be very horrific. It's quite very, very horrific. In fact, being in Nigeria, recently, I've been involved in some clients that are going through this kind of illness, and it's terrible. Okay, one of the presentation about, I need to let you know that one of the presentation that somebody that is suffering personality disorder, borderline personality disorder. Firstly, you need to understand that all of us, there is a way we behave, there's a way we think, there's a way we feel, there's a way we believe that make us predictable as a human being. Some of you that know me here, they probably think, they're coming to talk about mental health. They can probably predict that I'm going to talk about mental health because it's predictable. And doctor is coming, it's predictable that she's going to come, she's going to look elegant and stuff like that. So it's predictable. And it's predictable that she will say, I love life. It's predictable. So we are not surprised. But when the way somebody think, they feel, and they see themselves and they behave is causing them problem on how they see themselves and how they relate with other people. When they begin to behave in a way that is very excessive, okay, one thing about personality, people that suffer with personality disorder, one of their major fears is that they are afraid of abandonment. So because of the fear of abandonment, they go excessively, obsessively to connect with other people. So they have some kind of uncontrollable show of emotion. Okay, for example, if I want my partner to stay with me and I feel that I'm losing my partner and I want him to stay or I want her to stay with me, I can go ahead, I can go on and start cutting myself to really show the person that if you leave me, I'm going to do something dangerous to myself. So they tend to get connection in a very excessive and impulsive and obsessive way. And things has happened, which I think we're gonna elaborate later. So they show excessive emotion that is really, really seriously abnormal. So they are worried and afraid that they're going to be abandoned. And then they will do everything not to be abandoned. And some of the things is that because they fear that they will be abandoned from the beginning of a relationship, you know, they may meet somebody in the first day and they're already giving the person sex because they don't want to be abandoned. So they connect with people in a very abnormal and an excessive way. And at the same time, when they feel that they're going to lose those people, they show excessive behavior in a way that, you know, in fact, they can go to the extreme and attempt suicide because they felt that they're going to lose somebody that they feel that is very, very dear to them. So they show intense emotion, and it can last from within fewer minutes to hours, and it could go as far as for days. And they quickly change, the behavior change quickly. They find it very hard, to keep a stable relationship. There's a lady I met about 2 years ago in Lagos here, and she met somebody on Facebook, and she traveled to another state in Nigeria to meet the person, and in less than a week, and when she got there, she had sex with the person and she had sex with the brother. And by the time she returned to Lagos, and she felt she started alleging that she was raped. And by the time we analyzed the behavior, and it was obvious that she put herself in a very dangerous situation where she doesn't know these guys. She went to meet them in another state, and these guys are very, very horrible people. And she exposed herself. Sometimes because of that connection, they expose themselves to a very risky behavior. In fact, okay, let me give you some practical experience I've had. I've had a patient that I've looked after that she cut her stomach and her abdomen and everything came out. At the point where I was engaged with her, that was the second experience. I wasn't involved with her the first time the time when I was engaged with her, she was stitched. Her stomach was stitched. Her stomach was stitched. But apparently when I read through her incident, she cut her stomach and all her intestine and everything were out. And she was showing an intense pain of experience of abuses that she has suffered in the past. So that just shows you how intensely they can show emotion in a very controllable manner and very abnormal manner. They can do self-harming, they can self-harm, they can put themselves in dangerous situation, they can even take drugs excessively to deal with the emotion that they are going through at the moment. I think at this moment, let me just hold it there, and probably at some point I will be talking about real life experiences and situations and how people that suffer personality disorder, how they presented.
Thank you, Mr. Matt. You know, I'm listening to you and I am aghast. Like I said at the start of the hour, I said I am a complete blank slate when it comes to this topic. So it's a mix of shock, I'm just amazed at what you're saying, to imagine that we have individuals who are going through this kind of trying situations. You said something, Mr. Matthews said something about people with personality disorders, they connect with people in a very abnormal way, that there is an uncontrollable show of intense emotion that is abnormal. And the question I want to ask Dr. Time is, So how is this different from maybe somebody who's just a very maybe jealous or possessive person? How do we differentiate this intense, uncontrollable show of emotion in an abnormal way? How do we differentiate that from somebody who is just jealous, who is very jealous or very possessive, or somebody who is just a very highly toxic, dysfunctional human being? How do we differentiate between those two scenarios?
Okay, of course, when we talk clinical or we talk professionally, we start talking about assessments, okay, as a means of identifying and picking out the difference. But this is the reality, because when we talk layman, and every one of us who wants to be able to pick out these persons in our regular day, you want to know if your partner is like this or if there is something wrong. The frequency is what is a key word there, the frequency. How often does this play out? Okay, so now you have a, remember we said earlier that there are different types of personality disorder. And even that person who is just excessively jealous or is kind of controlling and all of that, by the time we put it into perspective clinically, we might be able to point out some deficiency or disorder somewhere also, okay? But so that we don't all panic and start thinking, oh my goodness, I mean, my partner is sick, something is wrong somewhere, then it's better we should look out for the frequency. How often does this play out? Do you see this intense lack of emotional control? Does it happen like every day? Or is it like once in a month? Now, even at that, remember we said there are just different degrees. It's just like when we talk about mental health and when we talk about physical health. Physical health, your body, if you are sick, you could have headaches, you could have body pains, you could have catarrh, cold, and all of that. And it might not be a serious infection. And then you could have infections, serious one. You could even have cancerous growth, serious illnesses. The same thing with mental health. So there are different degrees and different levels, okay? So we could have people who have just slight behavioral dysfunction, even at mental health level, and which also is a concern, because if those behaviors are not dealt with, just the same way if you have malaria and you don't treat it early enough, it could go on to become acute malaria. It could go on to become, you know, on, and even typhoid, and all of that could come from a single malaria that wasn't well treated. Okay, same thing with some of this behavior. So if you have somebody who is displaying some erratic behavior, okay, or eccentric behavior, even if it's once in a while, okay, it might be need to have concerns. However, the focus is so that you don't label your partners or the people in our immediate circle as having personality disorder. I think one core thing we want to take away is the frequency. How often does this person do those behaviors? If it's too often for comfort, then it's a sign that something is wrong somewhere.
Thank you, Dr. Timi, for that very important clarification on that. Before we move on, I am very pleased to announce that the third member of our panel has just joined us. So join me to welcome Holly Joy McCabe. I hope I got the pronunciation of your surname correctly. You are welcome. Kindly unmute yourself and do introduce yourself to us. Welcome, Holly.
Thank you. Hi, everyone. I'm Holly Joy McCabe. I'm in the US. I specialize in trauma rehabilitation. So I work a lot with the nervous system and help people with mental health a lot, from kind of tapping into their body and really connecting that way.
Thank you. I like it brief and simple. You're welcome to this conversation this morning. And I'm going to drop you right in the middle of this conversation. The question I asked previously, to which Dr. Timi gave an answer, was how do we differentiate between an individual with a personality disorder and someone who's just a highly toxic, dysfunctional person? And Dr. Timi hit on the key fact of frequency. So how often does the abnormal, the intense show of emotion, the uncontrollable show of emotion, how often does it happen with this individual? Are there any other ways from your experience? Is there any other way we can differentiate between someone who has a personality disorder and just another random person who's just simply maybe a very excessively possessive person or jealous person or just a dysfunctional individual?
Yeah, hopefully I'm not redundant to anything because it sounded like she really summarized quite well. I think context is maybe an additional element to that. What I think in today's modern world is we throw around a lot of titles and labels very haphazardly. Everyone thinks that they know a narcissist or someone who's bipolar because they've had a mood swing. And I think it's really done a disservice to the whole entire spectrum of personality disorders. If someone's acting hysterical because of an acute trauma or a certain situation, that's very different than them habitually acting that way all the time, as Dr. Timi stated, the frequency, but the context, the environment, what are they responding to is an additional element to that that's pretty relevant. What are they responding to? If that's consistently a response, obviously that's different. But I think that that's where a lot of people get thrown those labels very inaccurately and unjustly, is they're responding to a situation and not necessarily the best, because everyone responds with the best resources they have. But when people don't have the resources and the tools to respond appropriately, they can land with those types of behaviors that could be interpreted as such. So I think taking the context of the reaction or the behavior into consideration is pretty valuable.
Wow, thank you. That is so valuable. And I'm picking up on what you said about the labels that we throw around so easily in our world. I mean, if you look at social media, one person has to, the trolling, and then the next thing they are labeled narcissists. But one of the points I take from what you've said, Holly, is if the response to context is a habitual thing, it may be because that individual doesn't have the tools to handle their, to improve their response to context in a better way. And it doesn't necessarily mean that they have a personality disorder or they have a mental health issue. Thank you for that clarification. I pick up a statement from one Audu who says, this topic is really apt for me for this period. I am glad to hear that. And I hope you will be able to maybe share more on that statement with us when the time comes for comments. I would really like to hear more about that, why this topic is apt for you. Welcome, MC Compare. That's the name I see on your device. You're welcome. I see Misan. I see Olushola. I see Pasamayowa. Thank you, Dami Odukoya. Thank you for joining us this morning. Mr. Matthew, I'm coming back to you. Is there any other thing? So we have frequency, we have context as ways to differentiate between personality disorders and the rest of us who may not have that. Are there any other ways for us to make this important differentiation so that we don't wrongly or incorrectly assess people and then label them?
Okay, maybe I will add one or two. Like Dr. Simi have said, the severity, how severe is the intensity of the behavior? I mean, how dangerous or how much risk does the behavior put the person, either them or the people that are around them? And also another thing that we had is the fact that this kind of behavior, okay, the risk factor. How much risk? Because a lot of the time, the people that present personality disorder, they expose themselves to a lot of very severe risk. They expose themselves to a lot of danger. Okay, let me give you an instance. A client that I saw sometime last year, and you can imagine she suffered personality disorder, and she was referred to me by a psychiatrist. And when I saw her, she has a gang that they've met at the hospital. That at every time they want to go into the hospital, they will do some form of behavior, and they will have to be admitted. And the mother said, and she said, the parents have spent a lot, in the part of the world where you are responsible, the family or individual are responsible for their health care. And the parents have spent a lot treating the girl for over the years. And when I said that, she told me that she would want to come to the hospital. And I told the mother that I think at this moment, I don't think she's admissible, that I don't think hospital admission is necessary for her. But I told her that she will go to the hospital. She would. And the mother was like, we don't have the money and stuff like that. But do you know that by the time she got home, she was piercing herself, she was cutting herself because she wants to go back to the hospital. And she had to be admitted. When the kind of risk that has been involved, she had to be admitted. Even at that time, there was another time that she wanted to talk to me, because one thing with them is that boundary is that because they are so fearful, so worried that they're going to be abandoned. And it's because she's gone into therapy, she has seen me as one of her friends, as things, stuff like that. And there was a night that she was calling me over till morning. She called me about 50 times. And I intentionally didn't pick. But you know that in the morning, she told me, Mr. Shego, I'm pregnant and I've aborted. And I was like, and that really got me. How did you abort? And she told me, Mr. Shego, and she sent me a message. I used an anger to abort. And I didn't know how serious that was. So a day later, I went to speak at an engagement that American Embassy, they were facilitating in my country. I went to speak and I spoke on post-traumatic stress disorder. And I was like, a day ago, a client I'm seeing tomorrow, she's had personality disorder because of the trauma she has gone through in the past. And she told me that she used anger to abort. And the audience at that place were mostly students. And all of them were like, anger, yeah, it's the right thing. I was like, wow. And that got me more curious. And that got me, please, I can't tell you how she used anger. Do you know what I mean by anger? The anger you use to hang your clothes. She used the iron to do abortion by herself. And that just shows you, the kind of risk they can expose themselves, they present. So the risk factor is very high, because if you see somebody cutting themselves or somebody that is having, and a lot of the time with the experience of having personality disorder, when they are suicidal, a lot of the time, they didn't really intend to commit suicide. So they attempt suicide to get their attention. But once in a while, or accidentally, sometimes they ended up successful in their suicide attempt. Successful means they actually died. So the risk factor is a big one.
Thank you. Thank you for that clarification. It's getting clearer and clearer as we move along. Holly, I'm going to come back to you. You are a trauma specialist. Is there a role that trauma plays in personality disorders as a causal factor, or any other role that it plays in the subject matter of today?
Yes, thank you for that question. That's obviously the topic that I'm the most passionate about, and I think it's still really an emerging topic in the traditional approach to mental health and understanding of mental health, but it is endlessly both fascinating, the connection, and then the origins within it. Depending on the conversation that was already laid down about how to identify and how fully personality disorders will cover, I'll just kind of mention that the context that I brought in is a huge indicator of when trauma is a factor. So again, a lot of times people are responding to situations that they did not have the internal resources for. And oftentimes that gets misconstrued as a personality disorder because it's actually been long-term. like was mentioned, the frequency, but it's still a residual response. So trauma in the body plays out as sort of a threat. It puts the nervous system on high alert, and it makes people hypervigilant to many things. And when that switch can get pushed on, it can happen very early in childhood. It can be as a teenager. It can even be during childbirth that these certain traumas impact the body. They affect certain parts of the brain, and the system of balance and kind of equilibrium that's present in someone without trauma is very hindered. So you have these kind of highs and lows. People get, the switch gets flipped from things like driving down the road and somebody cuts them off, and it can actually trigger this entire cascade of mental processes, stress hormones, and things that present very much like a personality disorder, but really it's at its core a nervous system that's kind of offline, a nervous
All right,
system.
so sorry about that. Is it clearer now?
Sorry about that. Please, can you mute yourself? Okay, I've done that. Sorry about that, Holly. Please continue.
No problem. But the nervous system is basically, you know, meant to kind of go high and low, high and low, high and low, but very subtly. And when you have these severe traumas, and these can be physical traumas, they can be emotional traumas like abusive relationships, they can be just chronic, unrelenting stress. And these things really impact the body and the brain in very, very profound ways, and the way that the body and brain is able to go through life. So it's connected on more of a subtle level, but then also in a much deeper level, because again, it can affect the frequency, it can affect the context, it can affect literally everything that would present or be correlated with the personality disorder. And it's really amazing when you actually start treating the body and the nervous system, how much these things can actually regulate and kind of soften. You know, sometimes it very much is innate, and then it's compounded by trauma. Sometimes it's truly rooted in trauma, and again, the brain and the body didn't have the right resources to feel safe, so it could never really stop those really profound swings, those super highs and lows, those extreme reactions to things, because it's more of a body thing. So that's where all my, you know, body of work lies, is really helping the body kind of come back online and learn to regulate and process things where it's not going to those super extremes a lot.
Thank you, Holly. Dr. Timmy, I'm going to bring you into this conversation, and I'm picking up from what Holly said about the role of trauma and unrelenting stress, or that it could be innate in a person. So my question, and I hope it's not a, I hope it's not a stupid question. Is it something, so I understand what Holly says about, you know, trauma or unrelenting stress, triggering certain things, but a personality disorder, is this something one is born with, or is it something that can manifest somewhere along life?
Okay, that's a very interesting question. Thank you for that question. Now, that's the question that research and a lot of professionals are still debating till tomorrow. Now, as much as we know the mental health issues, sources of it could be genetic, hereditary, we also know that there are so many factors, environmental factors. Trauma, like Holly had said, is one key major factor that has been repeatedly confirmed to be a basis for personality disorder or mental illnesses generally. Now, when we say trauma, how does it play out as a factor in this case, particularly childhood trauma? Although we've also been able to see that as the case is, we have a lot of adult plays trauma also, not just childhood alone. But you see, childhood trauma has a lot of impact on our mental space. Another major thing that also could be a suspect, okay, why we think, is it innate or is it something that happens along life? Okay, yes, another factor to consider is the disconnection between the body, the spirit, and the soul. Now, there is a lot of connection. The way we are as a total human being, the functioning of our body, our brain, our soul, and our spirit. Once these three are in unity and harmony, and they're producing or working, particularly in the context of the society where we are, then we are fine. But once there is a disconnect between either of all this, and usually this could be, and that's why you find out that sometimes you have people who struggle with personality disorder being unnecessarily superstitious. Okay, you see a lot of spiritism, a lot of once there is a disconnect into one area, they then find a person focusing on one area at the expense of the other. Okay, so that also could be a source of it. So what I'm saying in essence is we necessarily cannot pinpoint and say is only one source. There are different things that lead on to personality disorder, including disconnect with the body, spirit, soul, including childhood trauma, including adulthood trauma, including what's it called again? Societal factors. Okay, there are so many things that could add up, and including one big one also that we need to also take note of is also the person, the individual, and then the exposures the person had had. So many things as such could add up to this. Thank you.
Thank you for that, Dr. Timi. You speak about the disconnect, or I'll call it maybe the equilibrium between body, spirit, and soul. So, and I'm going to ask you also, Dr. Timi. So just as a follow-up, is it possible to have a personality disorder and the individual doesn't know? Is the person aware? Can there be such a disconnect that there is a lack of awareness that the person has a personality disorder?
Usually till the point where the person could go clinical or people call their attention to it, most victims, most clients, most patients are not aware. Okay, so it's the people around them. That's why I keep emphasizing the society. Okay, what is acceptable in one society, in another society might not be acceptable, might be abnormal, might be taken as a disorder. So in one society, it could be accepted as norm. Okay, so, and in another place, it's abnormal. Maybe in one family, it's okay for you to tidy your room, perfect it all, and in another setting, it's okay to be rough, it's okay to be untidy. So societal factor also could be. So it's very possible for someone to actually have personality disorder and the person is not aware. So the people around probably will be the first one picking on. Now, usually, once this goes on for a while, at some point, because it begins to interject with the person's relationships, it begins to interject with their workplace, it would affect their lifestyle, everything around them in that society. Now, once that begins to happen, they will get a lot of feedback, possibly people telling them, oh, you are awkward, you are eccentric, something is wrong with you. You know, they start getting that. Initially, they might think they are not the problem. They might think it's the other people around them that is the problem, okay? And so till that point of awareness, some cases, it could be family members that would force the person to go in for clinical support or clinical assessment. Some other cases, the person themselves could decide to go in for an assessment to check, am I okay? Is everything all right? You know, but in most cases, they are not aware until it begins to impact negatively, most of the time, on their lifestyle and relationships. And of course, we used to say that awareness is the beginning of freedom, actually. You know, once they become aware, that means we are now getting to the point talking about recovery and healing.
So one can have the condition, and as long as there is no negative impact on their person and the people around them, it's a safe zone, as it were, and they can just breeze through life without even coming to the awareness that they have that condition.
Exactly.
Wow.
Exactly.
That is interesting. That is interesting. I'm coming to you, Holly, and but I'm not leaving you out, Mr. Matthew. The question I have for you, Holly, is, we are all there, about 21 of us here, and someone may wonder, why should I be concerned about personality disorders? What makes our discussion of this subject matter? What makes it necessary? In your opinion, in your experience?
Sure. I think the conversation as a whole is so important, because kind of tying back into what I said earlier, in this modern social media age, it's like titles and labels thrown around so easily. And I think now more than ever, there's a stigma and there's a misunderstanding, there's an exaggeration, and there's so much lacking just from the understanding of what a personality disorder is, what that looks like, and really all the things that we're discussing here. How does that impact you? When should you be concerned? So I think really understanding whether it's for yourself, I think, as Dr. Tini was touching on, a lot of times when people don't understand they have a personality disorder, they go through life and they have residual problems. They keep running into kind of the same situations, the same conflict. And again, depending on where they're at on certain spectrums, they either assume that everybody else is the problem, or they reach a point where they internalize and they start reflecting and they start saying, okay, maybe it's something here, maybe it's me. So that's really valuable for the individual, because then they can start the process of self-growth and self-inquiry and self-management in a way that's healthy for them and others. And then if it's somebody that you're in a relationship with or you're dealing with, having the real true kind of clinical understanding, or just even basic understanding of what it's like, and to engage with that person, to be in relationship with that person, when to understand kind of maybe the highs and lows or certain reactions or triggers, that helps the other person a lot as well. So whether it's something that you may be dealing with personally or with another person, understanding is everything. Like, from my perspective, we make judgments and we have reactions and conflicts so often when understanding is not present. So when we can bring true understanding into the situation, either for ourselves or others, then we start the process of connection and healing and optimal management, again, for ourselves or others. And I think understanding is everything. Just having that bigger conversation and removing the stigmas and all of the misunderstandings and labels and social media interpretation of things like this, and really moving towards healing.
Thank you. I'm so happy with the way you answered that, because it provides clarity on the need for us to keep having this kinds of conversations, because understanding the situation is necessary for optimal management. I like that. And if we know better, we do better. Understanding improves our awareness, and then we know where to go to for help, for assistance and support. So thank you for that clarity. And I hope every other person, every other individual on this call this morning sees the importance of the issue around personality disorder, because it's so easy for us to say, I don't know anybody who has a personality disorder. I don't have a personality disorder, so this conversation does not concern me. But we live in such a connected world that I think a shared understanding of these issues will be very advantageous to each one of us. Mr. Matthew, my question to you is, are these conditions, these personality disorders, and the whole spectrum of them, because you professionals speak about the spectrum from borderline and then the multiple personality disorders that we saw the video about, is it curable? Or are these permanent conditions that individuals have to live with and just learn to manage? So can one get better?
Okay, I think from a clinical experience, let me first emphasize that personality disorder is not usually a first line of diagnosis in psychiatry. So what I mean is that, in fact, a lot of professionals, psychiatrists, they usually there's a big argument around personality disorder. Some professionals, they don't just like diagnosing people with disorder because there's a lot of labeling and stigmatization that comes with it. In fact, I remember working in a clinical setting, and whenever a patient is about to be admitted into our facility, and they just hear she has a PD, you know that word. As much as possible, we try to decline the admission. We just tell you, even as a clinician, because they are quite in a very intense and severe circumstances, they are quite very challenging. But do these people come out of it? This is what I've learned in practice. Psychotherapy or talking therapy is a big part to manage personality disorder. And there is this therapy that has been, pathway that has been devised, which is called dialectical behavioral therapy. It does help a lot, and CBT helps a lot. But this is what we usually believe in a clinical practice. There is this belief that it gets to a age, and some of them, they just come out of it. So that's it. Evidence-based practice have shown that a lot of personality disorder, people that suffer personality disorder, they get to a stage, it's like the thing wears off. Especially when they get to a stage, they start taking some responsibility. But it now depends on how severe, because sometimes if the person has become a chronic state, because we need to understand there's an onset, there's a severe state, there's a chronic state. The chronic state, except miracle happens, the person may have to live with it for the rest of their life. So, but if it's in onset and it's still severe, and they have intervention at the very good stage, probably at the early stage, the chances are that the person have a better recovery, they have a better chance of recovery than somebody that probably, especially when you live in an environment, in a society where they don't even have an awareness, they don't even have doctors that have experience in this situation. So a lot of the time, if appropriate and effective help comes at the early stage, it does impact on the recovery state. But if unfortunately the individual did not get help on time, and the case becomes severely or become chronic, I'm afraid it could be a long time, because actually personality disorder is usually a long time issue. Because like I said, a lot of the time it's not a frontline diagnosis. Sometimes the person will have come, they will have probably think is depression. Afterward, they will say it's paranoid schizophrenia. Afterward, before. So after a while that some doctor will probably have, this is personality disorder. So imagine if they've been misdiagnosed along the way, it takes years before they are probably diagnosed. They have a appropriate diagnosis. And you can imagine, and that will count as it, because the behavior may have escalated, it may have exacerbated, because the person may have got involved in some kind of, because one thing with personality disorder, there is a combination of mental illness. There's also a combination of with behavioral problem. So imagine, and sometimes when they get into facilities, somebody that suffers personality disorder, there's something we call they take on what we call learned behavior. The person goes in, and maybe their initial diagnosis, the initial risky behavior they have is self-harming. They go into practice, they meet with some other people that suffer personality disorder, and they teach them some other behavior. I remember that I used to meet with this lady, and because she came into a personality disorder unit, she learned some behavior, and she will put batteries and things into her private parts. Because she goes there, she learned that behavior, and she feels, this is another way to cope with this problem. Because a lot of the time, people that suffer personality disorder, one of the things they suffer is that they want to look out for a way to come out from those emotions. So they want to avoid those emotions. So at every time, they tend to apply more pain, more pain, more pain, more pain, and the behavior gets escalating. So you imagine if they are not properly diagnosed at the early stage, and they keep having some kind of behavior. Sometimes it's drugs, sometimes it's binge, or they binge on food, or they eat less. And so I remember a situation. This pattern of behavior. There's a lady we used to know because we managed them for over years, and she doesn't used to. She wasn't anorexic, but at a time she went to somewhere and she learned that stop eating, starve yourself and stuff like that. And afterwards, she picked anorexic. She started being anorexic. So sometimes when they go into facility, they have learned behavior. They pick up learned behavior, and this may make that case very chronic and long term.
Thank you. Thank you for that. And Adironke says she agrees with what Mr. Matthew is saying. Holly, I'm coming to you. So I'm going to reel off a couple of things I've picked up from what Mr. Matthew has said. Personality disorders is challenging and it's stressful to manage, even to the professional healthcare providers, to clinicians. It's a long-term issue. They have to deal with misdiagnosis at the onset. It's a combination of mental health issues as well as behavioral issues. Then you have the risk behavior of maybe self-harm, drug use, and things like that. And the question I ask is, with all this, is it possible to be in a romantic relationship with an individual who has to deal with all of these factors and probably even more?
Yeah, I think the short answer can be yes, but as the groundwork has already been laid, the severity, the duration, the safety element, and I think what it really all boils down to is the other person aware, and are they willing to actually do the work? Because that's everything. And as it's already been stated, oftentimes there's that denial. I think in general, a lot of times, there's a lot of cultural stigmas that create hesitancies for acknowledgement, especially with men. Men are kind of taught to be these tough, push through everything. We don't have any problems. We don't need any help kind of, beings. And so there's all these different factors that are barriers to help. There's access, there's affordability, there's so many things. But if the barriers are removed or pushed through, and someone is willing to look at themselves, they're willing to acknowledge that there might be, a disruption, a problem, and then they're committed to seeking the help long-term that they need, I think yes. If that's not the case, if that's not the fundamental groundwork within a relationship of, hey, this is something that needs to be managed, just like diabetes would need to be managed, then I think that's where there's a problem. And I think, especially with things like kind of extreme narcissism, on that spectrum, in relationships, those can be the most toxic and dangerous because those people are the most checked out. They don't have that emotional intelligence to really be able to navigate their emotions or their experience. So they can't connect, they can't relate, they can't actually have compassion. And so they might have a moment where there's a breakup on the line and they say, oh, I'm going to change. And then they're right back. And that's where the toxic relationship cycles really come in. And I think that's where the education becomes so important, to know when there's just normal turbulence in a relationship and when there's something that talking it out, person to person isn't going to fix. It's not going to just be, okay, say you're sorry and let's move on. If there's a chronic, disposition presenting, then the other person is powerless to that. It really needs to be outsourced. And I think a lot of times when people are in love or they have a degree of compatibility, they try to be the one to fix the person or save the person, and they push and they push. And then this cycle, the push-pull just kind of escalates and it gets more and more extreme. And that's where you have those people saying, okay, well, see, it's the other person, because now the other person's engaging in this kind of back and forth. And So I think there's so many dynamics that it can go wrong. It can be misdiagnosed, even in clinical practices. It can be overlooked, it can be ignored, it can be all these things. But if someone's truly willing to acknowledge and look at and educate and connect into the resources, I think yes, absolutely. And sometimes I think they can be wonderful people because they're doing active self-work, and self-work for anybody is really good. You know, really tuning into yourself and processing and getting that support, that can make them excellent partners. But the willingness has to be from their end. It can't be a forced or a pushed thing. And often that does happen because the other person is kind of the injured party and they're like, you need help. And the other person's like, no, it's not my problem, it's your problem. So there's this tug of war. And again, if we can sink into that understanding and compassion and willingness, it helps the person get the help they need to be in relationship, and it helps the other person feel safe in the relationship too. So I think absolutely, but the work has to be done.
The work has to be done. Thank you, Holly, for that. And I'm on the right of what you're saying. I'm going to read a comment by Adelonke. She says, I used to have a boyfriend who would cut himself with a knife whenever I intend to end the relationship. But I didn't know why until I started researching about mental health. I would always think it was love. So how can we help our partner who has a personality disorder without hurting them? Dr. Timmy. And so the question is, before we help them, can you just, and I know Holly has alluded to some of that, in what are the ways relationships affected when there is a partner with a personality disorder?
Okay, if let me be sure I got that question well. We're asking how to help a partner to heal, or
no, before you answer that, in what ways are relationships affected?
Okay. In what ways are the relationships affected?
Yes.
Oh, with this,
so the effect, yes, with this condition, the effect of personality disorders on relationships.
Okay. The reality is it has a lot of effects, as in talking about how is it affected. I believe those who had experienced turbulent or toxic relationships, there's no word actually that can describe what they go through. You know, when you love someone so much and you could see the person, you could see another person coming out of that person at the same time. So it's really, really, really painful and challenging. Some people have had to make decisions to go on or to get out of the relationship, not because they don't love the person, they still even have feelings and emotions, but because of their own sanity, they had to leave. Some people had also begun to have mental illnesses or have mental health challenges also, because they are in a relationship with someone who has borderline personality. Okay, it's there's no way we can describe it, but the truth is it has a lot of negative effects on the other partner in the relationship. Sometimes the person who has to deal with the sufferer, the person struggling with the personality disorder, the spouse has to go through even a lot of self-denial themselves. They have to go through a lot of insecurity challenges themselves. You know, they're not certain what would happen next. They have to go through, in fact, sadly, many then ends up even having mental illnesses themselves also. So it's a lot. And like I said, there's really no word to describe what people in such relationships actually go through. I think also one quick thing I probably also want to comment on was a question Mr. Shego answered, to add to what he has said about whether it is curable, whether it is manageable, whether it is, you know, is there a way out actually? And I would say that in that space, it's important that we understand the clinical part and also understand the place of the fact that the body, the spirit, and the soul. the three. And like I said earlier, a disharmony between the three would end up in disaster. And so that means if we can begin to bring a synergy between the three, then the person might begin to find holistic healing. So while it is important to know that clinically, we do a lot, or the emphasis is on management. Okay. Subsequently, it's also important to know that people can actually recover, and then there's a place so that we're not surprised when we see healing and recovery. But the reality is, long-term, it's manageable. However, there are cases of recovery. So that's a point.
Thank you. That's good news to hear there are cases of recovery. And I want us to become practical now. You said, how do we, you said finding the balance between spirit, soul, and body. How do we do that practically? How does one who has a disequilibrium, as it were, in the spirit, soul, and body, manifesting as a personality disorder, how does such a person practically find that balance you speak about, Dr. Timi?
Okay, beautiful, thank you for that. Because it's important for us to know that every part of us needs to grow. The physical part of us, the spiritual part of us, and then the mind. So when we begin to seek healing and recovery, you will find out that the three parts is key to this healing, which means that it's important that first level of engagement means the person is going into therapy, and then when the therapists begin to look at an holistic approach to the challenges. So we're not focusing on one area. You want to check out what's your physical routine or the behavioral routine of the person is. You want to check out what are the mental or the cognitive routine of the person is. You also want to check out what the spiritual routine of the person has. You want to see and weigh where is there one tilting more than the other, okay? And so if there is, you want to put a balance into that. Once we begin to have balances on all of these areas, so we do not relegate any part of it. That way we begin to bring a synergy and an holistic healing approach to people who are suffering. So I don't know if I answered your question.
To people who are suffering, that the person with the condition as well as their partners. That is exactly is important. And each person, each individual needs some kind of intervention and help. And they are different because the intervention of the person with the personality disorder is different. And the intervention for the partner is different. And that's why I come to you, Mr. Matthew. What support, what interventions is available to the partner now? We know for the person with the personality disorder, I mean, there are clinical interventions, and management systems to the conditions. But what would you advise for a partner in this situation so that they are able or they are equipped to deal with the condition of their partners?
Okay, thank you. And I like the context where Holly was mentioning somebody, they are not equipped to manage, they were not equipped to manage circumstances and stuff like that. So, and I think that is really key in the sense that, like we do in therapy, one of the things we do in therapy is that we try to empower our clients in a way where they have techniques and strategies to be able to deal with whatever problem they might be going in their world. And somebody going through a partner of somebody suffering personality disorder, like has been highlighted, is hard work. Is hard work for anyone to be engaged with someone that suffers personality disorder. Just imagine the scenario that Aderonke painted, where at every time she wants to leave her boyfriend, that he self-harm so that to keep her in the relationship. So those are the kind of things the partner will have to go through, because this is one of the terms that make people label or stigmatize against people that suffer personality disorder. There's a word we use, even though it was in a clinical practice. I'm telling this, even though it's in a clinical practice. And one of the words we use is that they are very manipulative. You can imagine if people have that conception. They have that perception that people that suffer personality disorder can be manipulative. And you imagine when you believe that somebody is manipulating you, you can imagine how you will react. So one of the way we can support anyone, partner to people that suffer personality disorder, is the fact that one, they need to really look after themselves. Firstly, they need to have an awareness, understanding on what personality disorder is about, so that when they see their partner presenting certain behavior that looks abnormal, they will understand. You know, once they have insight and awareness, understanding, they have knowledge about what personality disorder is, and they understand. So whenever they see a behavior and they are aware of the expectation, the kind of behavior that they may present, he equips them, he empowers them to be able to understand and to manage it a bit better than somebody that did not even have understanding, that did not even have awareness on what personality disorder is. Another thing about personality disorder is the partner should learn not to be judgmental. They shouldn't be judgmental, because it's so easy. I've told you our clinical experience where we know we are judgmental, we call them manipulator, we call them all kind of negative labels. So the partner, for you to help yourself and to help your partner, you shouldn't be judgmental, because if you are, it's going to exacerbate the other person's presentation, and it's going to keep perpetuating that behavior, and it's going to be impacting your relationship, your connection with that person. So another thing is they need to also see the positive part of their partner, because one thing about people that suffer personality disorder is the fact that, you know, they can be so loving, they can be so generous, because a lot of the time they are because they want relationship, so they can give up everything to keep relationship. So their partner could probably look from that positive perspective that these people want some connectivity, they want to belong, they want to be connected, even though they may have a normal way they want to get this thing, but there's something in them that they want to be connected to the other. And another thing they need to probably do is that one thing that people that suffer personality disorder, they don't appreciate boundaries. They don't appreciate boundaries. So you can imagine when you have a partner, as a man or as a woman, you're hanging out with your friends, and your partner that suffer personality disorder, that have issue with insecurity, they can call you 500 times, because they are like, this person, where is this since? I've not spoken to this person all day. So they have to discuss things, they have to be discussion, continuous discussion, conversation that should happen between them, so that everybody will understand that, see, this boundary, I'm establishing the boundary for my well-being and for your whole well-being as well. So let's have understanding that at this point, when I'm doing this is what I expect, this is what is acceptable. So they can probably, they can define boundaries with their partner. So I think it's very, very helpful. And they also need to think about their own safety as well. They also need to think about their own safety, because no matter it has been emphasized over and over in this discussion, being engaged with somebody that suffer personality, not even personality disorder alone, any kind of mental illness can be very challenging to manage. So they need their own well-being too is important. They need to take care. And I like Dr. Timmy, she kept emphasizing it, holistic care, holistic well-being. Holistic well-being means the whole of the person, the personal, the physiological well-being, the psychological well-being, and the spiritual well-being. All of these things have to be attended to. So as an individual that is engaged with somebody that suffers personality disorder, you need to look after. Self-care should be important, because if not, you're going to burn out. You're going to burn out. So self-care, you're going to be exhausted, you're going to burn out. So self-care is very, very important. And you need to consider your own safety. And you need to learn more about personality disorder and the stigma that is involved. And take care of yourself by doing a lot of self-care. I can't overemphasize that. Self-care, self-care. You need to take care of yourself with take care of what you eat. Give attention to your own emotion as well. And above everything, two things I will add. One thing is I will suggest that occasionally it's good you see a therapist, either privately or with your partner. When your partner is being seen by a therapist, it's good you involve yourself in the intervention. It's good so that you understand what is happening. So as your partner is seeing the therapist, it's advisable that you too should see a therapist. And lastly, I will also add that it's good to be very prayerful. You need to be very, very prayerful. Whatever your belief system is, whatever you believe in, I think you need some kind of existential kind of intervention. You need to be prayerful. You need to connect to something that is beyond physical, to be able to anchor on. Because I think it's going to be very helpful, and I think it will be very, very therapeutic. I think those basic tips, I believe it will help. Thank you.
Thank you, Mr. Matthews. I mean, that is not basic, that is quite comprehensive. So thank you very much for that. And I don't know if Holly is in a position to answer this, and if you're not, it's fine. I'm picking up from what Mr. Matthews has just said about, and it was also something you also alluded to earlier about cultural issues, cultural stigma, and then Mr. Shego Matthews speaks about the spiritual, the need to anchor yourself to a spiritual higher power, if I can use that language. In the part of the world where many of us on this platform right now come from, spirituality is attached to this issue of personality disorder. So I'm looking at the video that we shared where, I mean, this patient is displaying several personalities. And in the part of the world, and I'll say Nigeria, where we come, where spirituality is faith, belief systems, cultural leanings are attached to a lot of things. How do we separate that from the real issue that personality disorder has to deal with? Because imagine someone who is manifesting all the kinds of symptoms and behaviors that we have mentioned today. The easiest thing that in our part of the world, the easiest thing is, oh no, this person is possessed by demons. How do we separate that? Because it may not be, well, if you look at it spiritually, because I mean, based on my faith system and my belief system, the basis of every sickness, I mean, there's a spiritual aspect to it. But how do we, yes, we deal with the spiritual aspect, but not use that to encapsulate the issue while ignoring maybe the clinical help that the individual needs. I've said a lot of things, and I hope I've not confused you, Holly, in the process. But the point I'm trying to make is there are cultural leanings, there are spiritual belief systems, attached to certain things. How do we separate that and ensure that our loved one, our partner, our friend, our family member, who may have a personality disorder, receives the help that they need? So we are not blinded or clouded by spirituality or cultural belief systems. You're muted, Holly.
Oh, sorry. That's an incredibly important question, and I'm so glad you asked it. I think it kind of really builds on everything we've already kind of discussed in terms of the education. The cultural and religious barriers, I think, are sometimes the last. They're almost impenetrable. It's like those are the things that they're just rock solid. And I think those barriers are one of the biggest and most important, because obviously if that barrier is in place and somebody can't even entertain the idea that there might be something else going on, they can't move past that at all. And another element that I actually specialize in that gets very ignored and kind of overridden is nutritional aspects. You know, there are times where things either get interpreted as a spiritual problem when it might be nutritional. And so I think that that exists in many different examples outside of religion or spirituality. The culture you're speaking of specifically, you know, that kind of has that context of this is a demon problem, this is, you know, XYZ. The education is going to have to be omnipresent, I think. The education and the awareness on a multi-system level, on a multi-tier level, I think has to continue to happen. I think that's why every single conversation like this is so important. Every workshop, every time someone's speaking about this in an educated way and in a compassionate way that says, it's not this or that, it's both and. I think that's the way we invite in maybe a little curiosity instead of get that like hard stop wall up. Because when we try to confront a belief system that's very old and we do it like a wrecking ball, we come in, there's a lot of resistance. So I think that sort of gentle approach of here's an additional piece that we could look at, and here's why that's important. Just like trauma, you know, when I always speak about that, it's not always the number one thing. I love that everyone here is in agreement that this is a multiple system approach. You really have to have this holistic perspective of the person, of the environment, of the tools, the access. You have to take all that into consideration. And I think that that's where we're lacking, is we're always trying to look at it from one dimension, from one perspective, and we miss everything else. And I think that that is our ultimate role as educators, as therapists, as healers, is to continue to be open-minded ourselves so that we continue to educate and learn to present the information that allows people to be open-minded and absorb it instead of feeling threatened or like, no, this is what I believe, this is what I heard. Because at the end of the day, everyone's a product of their conditioning, of their environment, of their teachings, of their, you know, religions. And you can't really fault them for that. They see things through the lens that they've been given, and that's okay. But if we can find a way to just soften that a little bit and say, here's this other additional element, and it's really important, I think that's how we really move forward as a whole.
Wow, thank you, Holly, for that. Thank you. I agree with you 100%. It is 3 minutes past 11:30. I would like to open the floor now for questions or comments from our audience members. So please, it's been a fantastic 1.5 hours listening, learning, sharing. So please, I would like to hear from us. Do we have questions? Do we have comments for our panelists this morning? Just unmute yourself and go ahead. No, ladies and gentlemen, there has to be comments, there has to be questions. Because this, yes, do I have a hand up? So I have Dr.
You're muted, Sister Jen.
Sorry. I'm going to read something off. And it's, I picked it up from what Mr. Matthew was saying about self-care and personal safety when it comes to partners of those who have personality disorder conditions. Aderonke raises an issue here where she says, what if both partners in the relationship have the personality disorder and they are not aware? How can that relationship survive? Dr. Timmy?
Okay, that's a beautiful one. Thank you for the question, actually. Remember, I had emphasized the place of context of society in your immediate environment to these issues we're talking about. So you could have a family where if they come out of their space, every other person is going to see them as dysfunctional. But within their space, they are okay with themselves. They do things irrationally within that circle. But to the largest community, they are awkward, they are eccentric, they're just different. So if in their own space, they both have these challenges and they are comfortable with themselves, it's working out for them, then it's not a problem. Are you with me?
I am, and if they are not a risk to their environment.
To one another and to other people out there. It's just like sometimes when we joke and talk about personality differences, not even disorder now, personality differences even in relationships, and you talk about the dynamism of the fact that you have a lot of opposites coming together, you know, and you're like, yes. Oh my goodness, the stress they give one another. What? Can't you just find someone like you, you know, and just hook up with that person? Both of you just go be together, you know, work it out together, you know. So reality is the fact that if both of them are challenged and they are in the relationship, to them, it's not going to look toxic. To them, they are okay, they are cool. We've had couples who, a very practical example is a couple who would, any conversation they want to have between themselves, they must be violent about it. They must scream. In fact, if you, I don't know if you remember, there was this man who recently spoke about his parents and the fact that his parents were having, that they were divorced like 3 times. It was in the news, it was in the US. So it said, and talked about, they were divorced 3 times, they remarried, they divorced, they remarried, they divorced, they remarried, you know, and he talked about even as a young child, observing this couple, that they would fight even to the point of having bloodshed, as in taking knife, his mom would take knife, the dad would take something, hitting one another, and they do all of that, and then finally they fall on the floor and have sex. And the kid is like, this is what it's saying. It was in the news. The guy wrote a book recently, I think it was, I've forgotten his name, but it was in the US. And it was talking about the dad finally dying, having sex with his mom in old age. They both became old and they continued that lifestyle to that. And this young man was talking and was saying to everybody out there, even to psychologists, to so many people, social workers who try to intervene in their home, they saw this couple as crazy guys, as in, but somehow they couldn't separate them. Even though they would separate, they would come back together. Even though they were violent with one another, which they were not with any other person. They were not violent to their children. They were not violent. It's amazing how it works out. But to them, they were okay. And they grew old enough. Even the man died, I think maybe in his 80s, having sex with his wife. He died on top of her. You know, and it tells you the dynamism when it comes to this. That is why I'm always very careful when we try to use one technique to deal with everything. That's why I'm particularly emphasizing the holistic approach, because one person's scenario would definitely be different from the other person. And when people come in the context of relationship, let us not be quick to, oh no, this is going to be toxic for you. What if it's not toxic? What if they both enjoy it? What if to them, they're cool? Another practical example is a client I had worked with, where this man and his wife, the only way they express love to one another is being abusive, as in verbally abusive. Okay, so the man was calling his wife and he said, oh, you did that foolish man. You know, you, who is a visitor to their home, you'll be like, is this normal? Is this okay? Okay. And if you try to rebuke the wife on behalf of the husband, the man gets angry with you. Why are you rebuking her? Did I complain to you? If you try to rebuke the husband, like you don't talk to your woman like that, the wife goes defensive for him. Why are you rebuking him? So these are toxic to the other person. These are toxic to the larger community, to the larger society. We know this is a disorder. But to those couple, they are fine. And so let's not look for problem where there are no problems, because to them, they are fine. Now, where we become concerned is when there are other lives involved. For example, children. For example, elderly parents that depend on these people. And now that's where social workers comes in. And you know what they do normally? They will just take the vulnerable people out of the setting and leave these two couples together. So not every, my point is so that we could be clear about the fact that not everything that looks toxic is actually toxic in the context of it all. The context is important and the people involved are important.
Thank you, Dr. Timmy. Yilayefa says, don't try to fix what isn't broken. All right, so I've given you, audience members, ladies and gentlemen, I've given you time to think about your questions. So please feel free to share your comments about today's conversation, or if you have questions to pose to members of our panel, please go ahead. Okay, we don't have any comments yet or any questions. So in summing up, as we round up, because we have about 15 minutes to the end of today's conversation, I would like Mr. Matthew, because Mr. Matthew needs to leave soon. What will be your final comments today? Just to wrap up, to sum up what we have spoken about.
Yeah, I think one thing I want to really emphasize is for us to understand that personality disorder is a very challenging disorder and is highly stigmatized. And I want all of us to get as much awareness as possible, not about personality disorder alone, about all kind of behavior that seems abnormal to us. Because the more our awareness expands, the more our misconception the lesser the misconception we have, the more accepting we will be, and the more we'll be able to relate with diverse kind of behavior, so that we'll become less judgmental about other people's behavior. Let me just briefly add to something Doctor said, and I remember a scenario. That hello?
Hello, Mr. Matthew, are you there?
Hello, can you hear me?
We can hear you.
Yes,
yeah,
we can hear you.
I remember a scenario that a colleague of mine, she was handling this case, and it was confusing for her. She was in a dilemma. Can you hear me? She was in a dilemma on how to handle the matter. So what was the case? The case was, they are a couple, and when they were dating, they used to bring their friend. The lady will bring her friend, the man will bring his friend, and they will have foursome. And in the course of doing that, when they were dating, that was their life. While they were dating, the lady became pregnant for the man, and then they got married. And they've been married for years, functioning like that. So the other one brings their friends, the lady brings her friend, the man brings his friend, and they were functioning. And their marriage has been functioning that way. And now, they now had problems recently. And what was the problem? The problem was the man told the wife to stop bringing her friend. No, the man stopped bringing his own friend, but the wife has to continue to bring her own friend. So the agreement, the condition has been broken. So, imagine you hearing that kind of situation at first. It's easy to get judgmental and feel, this is so dysfunctional. And like what Doctor was trying to say was that we shouldn't catastrophize people's life. Yes, they may not align with our own, they may not align with our own values. We are not, like I keep telling people, we are not value police. We are not character police. So yes, they may not align with our own value. We may not agree with those values, but we need to respect that is their choice. We need to respect their autonomy. We need to respect their independence to choose what they want to do with their life, even though when it's not in alignment, it's not in congruence with our own value. Yes, when they ask for our own perception about their way of life, yeah, we are free to tell them that for me is no, but I respect you. So what I'm saying is that we should respect the individual. We may not agree with their behavior. Well, we should respect them. We should value them individually. We should love them individually, even though when they do something, when they do behavior, when they're involved in a behavior that seems abnormal to us, that seems incorrect to us, that seems unacceptable to us. But we should respect the individual. The same also goes to the people that suffer personality disorder. We should take the behavior out of the person. We respect the person and see how we can help them. That the behavior may not be their fault. It could be as a result of experiences they've had in the past. And research I read recently have alluded to the fact that about 76% of people that suffer personality disorder, it has a consequence as a result of a past experience. It could be abuses, it could be neglect, it could be environment they find themselves, it could be combination of so many factors. That some of us, if we go through the same experience, we end up like them or even more than them or worse than them. So what I'm employing all of us this moment is we need to build empathy for people that present this kind of behavior that seems abnormal to us. Thank you very much.
Thank you so much, Mr. Shegun Matthew. Thank you. That is that is another take to this subject matter, and I'm glad you were able to share that with us. You did allude earlier when you said personality disorder sufferers do not appreciate boundaries. And, you know, the examples you keep giving, I'm so alarmed, or maybe it's just I'm so alarmed, but I understand, even without being judgmental, I understand what you're saying about the boundary issue. I see, you know, the issue about the foursome. And it also reminds me of a conversation we had, I think it was 2 weeks ago when we were speaking about, or was last month, about addiction, where we had a panelist, Mr. Focus, was saying, if you have two people in a relationship, and I think Pastor Mayowa, who is here, who was the host on that day, where he said, if you remember, he said, if you have two people in a relationship who enjoy watching pornography together, how is that wrong? And I'm thinking of the conversation we're having right now, and I'm remembering that, because I'm sure a lot of people were alarmed that day, you know, in the audience as that issue was being discussed. So I have a comment here from Simi, who says, I believe science is knowledge from God. And if we don't seek that knowledge, then we perish, like the Bible says. However, I believe the spirit governs the physical, because the order of nature even follows that order. Having said that, it's good to be aware of whatever disorder one may have or a partner may have to be better informed. Seek help, manage one's mental health, but importantly, pray the right prayer and lean on the Spirit of God. We concur 100%. Awareness is the beginning of freedom, says Aderonke. I am aware Mr. Shegun Matthews has to leave. He has informed us previously. So I'm going to say thank you so much, sir, for the level of awareness that you have brought even to the subject matter. For me personally, I announced so many times at the start of this morning's conversation that I am a complete blank slate when it comes to this issue. And even as I was coming to host the conversation this morning, it was with a lot of trepidation, because I'm like, I am ignorant about this issue. How do I even begin to moderate a conversation that I know absolutely nothing about? So I'm so grateful to Mr. Shegun Matthews, to Holly Joy McCabe, and Dr. Timi, who have illuminated this subject matter to all of us this morning. So thank you very much. So he has taken his leave. Thank you. Holly, I'm coming to you. Please, your closing comments on this subject matter as we come to the end of the conversation.
Yeah, well, first, thank you for having the conversation and, you know, being willing to ask the questions that are uncomfortable, because I think with every single issue we face, having people that are willing to ask questions when they don't feel comfortable is really at the key. You know, it's such a huge element. My closing thoughts are a little bit of a build on what Mr. Matthew was saying in the context of that judgment and that pushing, I think is really vital, because what I see a lot is I work with a lot of people that are partners or have been in relationships with people who are abusive and may present as someone with a personality disorder or, variable degrees of toxicity. And there's that struggle I was mentioning before of when people have their judgments of how someone should act, then they try to implement these rules and these boundaries and these, here's how you fix yourself, or I'm going to try to fix you. And that really compounds kind of a vicious cycle of codependency where the partner tends to lose themselves in trying to fix the other person. And then the other person, it's basically like seeing an issue through two completely different angles, and you're always at odds. And so I think that the education is really important for the understanding, but also I think we have to continue to stand up and be advocates for ourselves, and for always keep, like, we are our only responsibility. We can't be responsible for anyone else. I mean, obviously with the exception of children or people we're caregiving. But I think when people feel like they need to fix someone else, that's really just a judgment. They're saying, I think you should be like this, and I want you to be like this. And that other person doesn't have any interest in changing or being like that. And so I think that that's a big element that creates a lot of conflict in general, a lot of unnecessary stress and turbulence in relationships, or just encountering people in general. And so I think always taking a step back from judgment and trying to see things through compassion and understanding applies to everything, whether it's addiction, whether it's hard conversations, whether it's do I stay or do I go. When we take our own judgments out of things, we see things very, very, very differently. And I think that that is very important across the board. Again, for the person, for someone dealing with the person, for professionals, I think we always just have to take that step back and kind of let down our own preconceived notions, our own filters, our own perspectives, our own cultural bias and all this, and say, let me look at this differently. And I think that's a really important element.
Thank you, Holly. Thank you for your time. Thank you for the quality that you have brought to today's deliberations. We appreciate that you have taken out time. I know it's quite early, depending on which city you stay in America, but thank you for joining us. We are so appreciative of your presence with us today. Thank you.
So thank you for having me. Thank you.
Dr. Timmy, can we have your closing comments?
All right, thank you so much. It's a great honor and just a great privilege to actually be on this awesome panel, meeting Holly. Mr. Shego, I know him very well, and meeting you and everyone, it's beautiful, and I believe it is. And one key thing I would want to leave everyone here with today is to understand that relationship is actually a threefold and not twofold like we're all taught traditionally, where you think it's just you and your partner, and then you're going through stuff within that fold, and you keep on holding on, particularly if you're African like myself, and you keep on saying, no, it's our issues, so we should deal with our issues. No, not at all. Once the relationship, and you could pick out that there are some unhealthy reactions and behaviors in your relationship, you are expected to seek help. Now, I want us to take note of the fact that some of us think you could help your partner, or I love him enough, I can help him heal. Some your partners have told you their history, or they told you their childhood trauma, the experiences they've been through, and then you are like, oh my goodness, I'm going to help you heal. My love is enough to help you heal. No, not at all. I'm sorry, but truth is, love is not enough to heal. There are procedures, strategies, techniques needed in the healing journey. And I love the person who had dropped a comment for us talking about the holistic, the part of the spiritual and the need for the emphasis of the physical, going to for mental awareness, mental checkups, being in summary, Let professionals do their job. Science is of God. Knowledge is of God. The fact that we go the extra mile, and if you are skeptical about traditional psychologists and or psychiatrists and the way they process work, there are so many faith-based psychiatrists and psychologists that could understand your journey, they could understand your faith and be able to help you combining science, spirituality, and physical together to be able to get us to that journey of healing. And lastly, emphasis, seek help. There is no matter, there's no point trying to act smart. Every one of us have this pressure. Remember what I said, just like physical health, mental health is the same. And mental health also has degrees from regular, from onset to severe to chronic. When it is still onset, when we're going through depressing situations, when we're going through serious emotional pain, when we're going through traumatic experiences, please, let's not just think I've dealt with it. One key principle about trauma is time doesn't heal it like many people think. Time doesn't heal those wounds. There is a process to the healing. So please, let's learn to seek help. Psychologists, counselors, psychotherapists, psychiatrists, they all have a role to play. Let's not be afraid to seek help. Thank you so much.
Thank you, Dr. Timi. And to facilitate the process of seeking help, we would like our panelists to tell us where we can find them, because one of the things we do on this platform is to not just to have conversations about issues, but to also facilitate, access to the resources that are available out there that people can, access for their mental health well-being. So I would like Dr. Timi and Holly to share maybe their social media handles or websites, or where we can, follow them and access them should any one of us here require professional help, support, and assistance. Over to you.
Okay. Would Holly go first? Oh, you want me to do that?
Go ahead, Dr. Timi, since you're muted.
All right. Okay, so first of all, my social handles are Timi Oyebode. And I run the foremost ADI Counseling Center. So if you're in Lagos or you are anywhere around here, you might want to come to have an experience and understand how psychotherapy works and how support could be holistic, actually. My handles, Facebook, Instagram, LinkedIn, is Timi Oyebode. I'm trying to drop that in the chat box now to say at Timi Oyebode, Timr. Oyebode is Oyebode, at Timi Oyebode on all social handles. Thank you.
Thank you. I'm already noting your website. I also see Holly's website. So Holly, do you want to share your social media handles, or the website is simply where we find you?
Yeah, so my social media handles are all Spiritual Fit Chick, and that's the website as well, spiritualfitchick.com, and that's stuff that I do. I have my therapy practice in Charlotte, where I see people directly, but the energy psychology work and stuff that I do, I work with people around the world with different modalities. So yeah, you can find me pretty much anywhere at Spiritual Fit Chick.
Spiritual Fit Chick. I like that. So thank you again to you, Holly. Thank you to Dr. Timi. So it is a very enlightening session for me, and I'm sure members of our audience will agree that in one way or another, we have learned something today that has improved our awareness and knowledge about personality disorders and how to support our partners should we have family members or ourselves who find ourselves in a relationship with patients who have personality disorders. Thank you. Without you, the audience, we wouldn't have a conversation. We thank you for your time, because time is money, time is value. You have given us 2 hours of your time this morning to listen, to learn. So we are so grateful. Thank you. Thank you. We hope that next month we'll make it another date, with us on the conversation at MindSpec for us to talk again about life and the issues that affect our mental well-being. I'm going to hand over to Aderonke if you have closing comments to make. Thank you.
Well, thank you, Sister Jem. Thank you very much, sis. Hi, Holly. Hi, Simi. Thank you for saying yes to this call. Thank you. Holly. And so, guys, help me thank Holly. I'm meeting Holly for the very first time too. So, and
thank you, Holly.
She was so honored to say yes to join us to today on this conversation. Thank you so very much. We appreciate it. And I really appreciate every one of us here present on this call. Thank you for always coming through. I can see new members. Steliatu, thank you. Oh, thank you, Sister Yemi, for coming again. Thank you, Andre. Thank you, Sister Priscilla. Sister Tony, thank you so very much. Alayide, God bless you. Thank you. Thank you, John. Thank you, Nimat. Right.
Thank you, everyone. Thank you very much.
Weekend, guys. So in case you want to join the community, we have a community. So if you want to join, I would share with us the handles, so you can just click and join I'll just share the link with you here. Then you can just join Dr. Timmy, and she's available also so if you need counseling, you need anything in regards counseling, please do. And if you want to learn more about counseling, the school is available and affordable. Please do. And I believe Oli is also open to speak to us in terms of if you want to have anything in mindfulness, in therapy session for trauma and all that. Please, let's reach out to them. Thank you very much and have a blessed weekend. So I've shared the link. Please, if you want to join the community, please reach out to us via the link. All right, have a blessed weekend, everybody, and bye. So I will talk in the other room.
Thank you.
Have a wonderful weekend. Enjoy, stay safe.
Yeah, bye.